In the last decade here at University at Buffalo, we spent a great deal of time and research to define potential biomarkers, imaging biomarkers, for determining short and long-term disease progression in patients with multiple sclerosis. Most recently, we discovered that particular regions of the brain may be more suitable to predict who is going to progress or who is going to remain stable over long term.
Well, as a neuropsychologist, my main emphasis is on memory and other cognitive functions. And MS patients have problems in cognition. So we were very interested in the question of what aspects of brain MRI predict who will become cognitively impaired. Who are these MS patients that are vulnerable to this particular problem? Can we tell from MRI who will develop cognitive impairment? When we asked this question some years ago, we found unexpectedly that an area of the brain called the third ventricle is the most predictive component in conventional MRI measures of cognitive impairment. And the third ventricle is an area where there's cerebrospinal fluid that if there is loss of tissue around it, it gets bigger. What's around the third ventricle? The thalamus. And so we thought perhaps this very important structure in the brain is showing atrophy in the early stages of MS. So we tested that hypothesis by using some new techniques that allowed us to look at the volume of the thalamus with MRI. And when we did that, we found that the volume of the thalamus was the biggest predictor of cognitive impairment in MS patients.
Only recently, our and other collaborators' research pointed out that studying this region may be extremely beneficial for the patients with MS, both in clinical routine as well as in research terms. In particular, we conducted a number of recent studies and trials that showed that thalamus region and changes in volumes of thalamus regions as well as accumulation of iron deposits in thalamus may be extremely sensitive tools to predict who is going to develop or not develop disability progression in MS.
Well, the next steps are to follow patients what we call longitudinally, so that we can see how these different aspects of atrophy evolve over time and how changes in the psychology of the patients evolves over time. Some patients are developing memory problems. Some patients are developing slowness in their thinking. Some patients are even developing subtle changes to their personality. And we would like to follow those subtle changes with the subtle changes in the thalamus atrophy and see if we can tie those together and learn about how the cognitive impairment, or in some patients even the dementia of multiple sclerosis, evolves. If we can understand that, then we can identify patients very early on that are at risk for those problems and perhaps even prevent it someday.